Our next presenter has been here a few times. He's a SummerStrong Hall of Famer. He's my doctor. He's working with my mom, worked with my dad, worked with probably a lot of people in here, especially if you're in the professional sports world or just wanted a great level of care, and that is Dr. Eric Serrano. And Doc Serrano runs Serrano Family Practice with he and his wife, Lisa, who's also a doctor. They're up in Pinkerton, is that right? Ohio. And they've been around a long time, and they've done some pretty amazing things at a lot of different levels. He's the guy that I call when I need a little bit of the inside scoop. And this section is going to be called Ask the Doc. So we're going to just field a bunch of questions, and so you could catch him off guard if you want, catch him flat-footed. And so we're going to take on questions, but with no further ado, Dr. Eric Serrano.
First of all, I want to say thank you to the speakers. I learned from Dr. Galpin about some cool stuff that I had no idea. I want to ask you guys a question. Who knows about God here? Who knows about God? Nobody knows about God? Come on. Who knows about God? Okay. So, oh, my God. Okay. So, who knows about God? Raise your hand. Okay. Who knows God? I like that. I like that. That's like ChatGPT crap, right? You know about it, but you don't know it well. Same thing here. I have a lot of people that came to me and offer questions, and I pick a few people to answer those questions. Now, you can ask me anything you want, hormones, about life, and things like that. I learned from Dr. Galpin that the technology and what they're doing in labs is impressive. I also want to tell Dr. Galpin that some of those blood tests and levels that they're doing, they're bullshit, okay? So not to Dr. Galpin. I'm saying about blood test results. For example, vitamin D levels are between 30 and 100, right? That's what they consider normal. Beyond that is abnormal. In my pocket, in my phone, I have levels of 500, 600. The highest level of vitamin D that I have in my office is 680. Toxic. He goes to the hospital, he's going to die, right? But he has multiple sclerosis. He's normal. This is 24 years. He's totally normal. His vitamin D levels go down, he gets symptoms. I have a patient that his levels are 504, all here. Now, never take vitamin D without vitamin K. Joe, you hear that? Where's Joey? Thank you. Never take vitamin D without vitamin K. Never take it alone. You require vitamin D with vitamin K. Why? Because when you take vitamin K, you activate osteocalcin. It takes the calcium that you're absorbing because you're taking a lot of vitamin D and puts it on the bone. So whoever tells you to take vitamin D by itself is lying. If you're taking less than 5,000, you're not taking enough. Let me repeat that. If you're taking less than 5,000 IUs, you're not taking enough. Okay? Be aware of that. I learned from Jim, coach. I learned that if you live on the past, you get depressed. If you live on the future, you get anxious. So live on the present. It's a gift. Live now, not tomorrow, not on the past. Learn from the past so you don't repeat the same mistakes. Remember that? And community and faith are huge. I'm going to start with shoulders. I need a big black guy strong enough. Coach Ivy, come over here. I mean, I was going to pick Jen because I like looking at her, but I need somebody strong, right? Wait. Jen is good looking, and we're going to look at other parts. Let's start with shoulders, right? And I want a really strong man. Coach, can you shoulder press this? Look, go for it. I'm not touching you. I'm back here. Shoulder press. How cool is that, right? The reason I'm doing this is because I get him in a second, and with a PVC pipe, by the way. The reason that I want to show this is because most people, when they do therapy for the shoulders, they say that the rotator cuff does external rotation. Which, how many therapies here? Oh shit, I'm going to look bad. Well, the shoulder rotator cuff doesn't do external rotation. That's a lie. What the rotator cuff does is lowers the ball of the shoulder to move freely into that joint. But most people do this, right? That's a masturbation exercise. That doesn't do nothing for you guys. Okay, so be aware of that. So when you have a client, you also don't want to hurt that client. So I'm showing Coach Ivy, can you do that again, shoulder press? Piece okay, right? But now, when we train shoulders, we tend to do only one range of motion, either this way or this way or this way. I want that shoulder to be strong. I want that shoulder to be able to push that ball into the socket. So I'm sorry, guys, but we're going to go to one of the power racks here real quick, and Coach Ivy is going to sit down on a bench and just push that up, right? And we're going to see how he does with a little bit of excitement added to it. Let's go.
Okay.
Come with me. Can I borrow that chair for a second on that bench real quick? Coach, you're going to sit over here looking at me and my beautiful body. Okay, Coach, move back a little bit. A little bit. Right there. Put that behind your head and shoulder press it. Piece okay, right? Everybody can see that, of course. But you're looking good, right? So now I want to add, how can I make this difficult, number one? Number two, how can I make him be able to actually prevent injuries later? Most of the common injuries either are when I'm standing rotating or when I'm fully contracted, right? So I'm going to show you guys a way that he has to do it. Now, he has to do it slowly. The key to this is he has to keep that PVC pipe against this. So go ahead and do it again. Keep it back there and push it up. Piece okay, right? I like that. I like that. So we want to do something here. This is the wimpy band, right? This is the orange band, right? Coach Ivy has been at my house a few times, so he knows he's smiling. Okay, Coach, your life depends on you keeping that dumb PVC pipe against that. I want 3 reps, 5 seconds up, 5 seconds down. Got it?
You're not going to pull, are you?
No, I'm not going to do that. I'm going to hold it here. That is not touching. Make sure that you touch. Okay, go. Go ahead. I want 5 reps. Go. Come on. Oh, look at that. There we go. Now, I can make this, nothing on life is stable. So I can make this, Coach, you're suffering there. Come on. So this is it. Now, I'm being nice to him because I'm doing this, right? Now, if I do this, then it becomes a very hard exercise. One more, Coach. One more. Ooh, there we go. Coach, you got to touch it. There we go. One more, Coach. Come on. Woo, there we go. I want to applaud for my model here. Now, that exercise is very easy. How hard was it?
Pretty difficult.
Pretty difficult. Now, I did it only this way. Now, for you guys, you can change it anywhere. I have 4 bands because I can tie this to the top. Okay? Now, I force my lats to do what to the shoulder joint? So those therapists, where are they? What do I do if I put the bands on the top and I force him to pull down? He's doing what? Kind of a pull down now, right? So he's forcing that joint to stay stable there, not only with frontal and pulling away, but he also has to pull and push down. He's pushing and pulling at the same time, which you can rarely do that in any machine, true or false? I can make him pull. You guys want to see it? Okay. It was them, Coach. It was them. It wasn't me. Okay, Coach, you got to help me. I'm not that tall. Can you put that band up there? It doesn't matter. Yeah, that's fine. I'll give you the other one, Coach. So now we have an exercise that is going to give you resistance coming down, but also going up, so which is very rare, okay? This allows you to do the exercise. So Coach, here we go. Put that there, and after you can hold it on the rubber bands. So now what I'm going to do is, go ahead, Coach, 5. Go. Keep touching that. There we go. Now, I can make the band shorter, but you guys see what's happening? So he's forced to pull down with it. So not only he's going up, he has to pull down, actually, if I make that band shorter. Got it? Any question? Also, this is easy because I'm not being an ass to him, and I'm going to pull, giving different forces from different angles. Any questions about that exercise? Okay. You're done. You're safe. Okay. I'm gonna spend about only 10 minutes on each. Now, I need Alejandra here. Where's Alejandra? Alejandra came to me, and yesterday she showed me x-rays. She does have arthritis on her hips, left worse than the right, but also on her iliac crest, she has what is called fibrin, or it has little destruction of the bone, right? On the origin of the adductors and hamstrings. So she's having pain, and she talked to me yesterday, right? So she said, I don't want her squatting. But the reason I don't want her squatting is because her left hip, already the ball of the joint is going into the space. Also, it's developing spurs above and below the hip. So she said, I want to squat, I want to do things. I want to give her a set of exercises in which I can allow her to do what she needs to do. She told me I like to walk, right? I like to go up hills, I like to do those things. So I want to give her some sort of resistance that I can use without affecting her joint. So I'm going to have to do what to the joint? Kind of unload it, but load it. Now, how can I do that if I'm hanging up? So I'm going to show you guys. Usually I like to use chains for this because I want to measure what kind of weight I'm using. Do we have chains anywhere? Do we have a small set of chains or not? Can I have them for a second real quick? Oh, no, one. Shit, no. Okay. Now, this unloads the hip joint, right? Also creates strength. I'm just going to give you one version. There's about 10 versions of it. I'll do 2 or 3 so you guys learn it because it's going to really help you. This develops the hip. This develops your hamstrings, but also develop one of the most important things. If your hamstring is not holding your pelvic stable, what holds my pelvic stable? Who can answer that? If my hamstring is, or my adductors are not holding the pelvic where it's supposed to be, what is holding my pelvis steady there? My lats. Believe it or not, my lower lats. Remember that, it's crazy. Because my lats attach right here in the inside, and they go down to my bones right there, right? That's what I'm going to use Jen here in a second so you guys can look really nice, right? But Alejandra looks pretty good too. So what I'm going to do is I'm going to force her to unload the hip, but I'm going to make her use her hamstrings so she's able to do exercise without putting pressure on the spine, without putting what? In the joint? Pressure. So we're going to unload it, but we're going to load it. Now, this creates, she has to hold pretty tight, so girls have to be strong enough to be able to hang there. The reason I want her, I don't want it just hanging my joint, holding it, my elbow or my shoulder. I want her to lats to contract, and she's going to go, okay, can you get up there and hold yourself?
I don't know if I can make it.
See if she can make it. I'm going to have to bring Jen. You got to look away from me. Yeah, look away from me. Okay, so that's pretty good. Now, I want to load the hip. I want you to do a leg curl for me. Bring your knees back. Bring your knees back. Oh, yeah, you got to hold it. Oh, wait a second. You got to hold it there. You ready? Okay, so notice how she's doing with her feet. That is, and putting the hips forward. You guys see that? She's pulling the knees forward. No, that's bullshit. I want those knees back, and pointing. Oh, tell me when you're done. Okay, so I want this because, believe it or not, your big toe, come on, hold that up. There we go. Are you ready? Come down for a second, Alejandra. How was it? Okay, so I unloaded the hip, I unloaded the spine, but I loaded her hamstrings and her glutes. Now, I'm going to be an ass, of course, with Alejandra, because her husband I know a little bit, so I'm going to make her life a little bit miserable. That's one way to do it. Now, note that I use both feet at the same time. The reason I was doing that with her, I had never done it with her. I don't want to push her right now. But if I wanted to push her because she had difficulty with the left, the left hamstring? The left hamstring, I'm going to do something a little bit different. Now, how much did they change it? 25 pounds? Yeah, 25 pounds. So I might want to use 5 pounds. Go up again. Now, this develops the strength of the fingers with the strength to your lower lat, because when you're forcing to go back, you have to activate. Now, note that I'm going to do something real quick here. Okay, I only want one leg back, and you're going to stimulate like you're running. Go, jump up, and I want one leg forward, right there, like that, like you're running. This actually imitates, so I'm going to put one here, which is going to be very heavy. So I'm going to put it right here. I want you to go up, come on, and point that back. There we go. So now she has to hold that, and then I will put another chain there, and I will give her what? Unload both hips at the same time, one with flexion and one with extension. And then switch really fast, switch really fast. Woo, okay, so she knows what she's doing. Now, that is 2 ways to do that. I'm going to do one more, because I got to jump from subject to subject real quick. I want to involve the adductors. How can I involve the adductors up there? Come on, guys. I don't want to sit here and just talk. Yes, I love you for that. How will you do that? A medicine ball, correct. Or actually, I like to use a very small dumbbell. The reason I want to use the small dumbbell is because I want to know the ball kind of slides out, the dumbbell doesn't slide. But a ball would be perfect for her. So can I have a medicine ball, please? A very, very small weight, please, not a heavy weight. That's okay. How big is this one? 10. She can handle it. She can handle it. How much is that one? This is too big. Okay, so I don't want that. Now, I'm going to bring Jen here. I'm going to make Jen do stuff in a second. Up there. Okay, now, wait a second. Know where I'm going to put this. Turn around for a second. Hold yourself there. I don't want to put it too high because then it doesn't create the force that I require. It's very hard to do it. I need to put it, open your legs for a second, at the knee level, right there. That's what I want to because I want her squeezing. That's what develop power. Now, I did what? I want those adductors to work at the same time that my hamstrings because that's what happened in real life, correct? They don't work without other. Up again. Squeeze the ball. Squeeze it. And bring it back. I'm not even going to put the chains because this is actually really hard. Because now the adductors are not helping you to do your leg curl. Come up. Thank you very much. And then I can put all the forces there. But that unloads her hip, makes the hamstring work. I'm making the adductors now. It's completely releasing the hip. Can you feel it, Alejandra? Yes. Okay. Yes. Okay. Any questions about that? Okay. Thank you, Alejandra. Now you know. You got to do those at home. Jen, I'm going to make it very difficult for you. Come on. Oh, my God.
Hey, you did good. If a gal has grip strength issues, couldn't you put them in straps as well?
You can, but I do not like that. When you guys, and I'm going to be in trouble here. I know a lot of people use straps to lift the weight. Are you helping your grip or are you helping your biceps, your shoulders, and your pecs? What are you helping when you do straps? You help the whole thing. That's when you get more tears because the joints, the muscle is not ready to hold it. If your freaking grip fails, you're not fucking strong to hold the bar. I don't care. I'm just saying, do not use straps. That's a wussy way to do it. Yeah, I do it. I know. Hey, on my time, I was very, very good. And I'm telling you this right now, the grip is the secret for you not to get hurt. If you cannot hold the bar, that's your body telling you, you cannot do it this way. You go do it for a second, but then, oh, my back hurts, this hurts. No, don't do it. Develop the grip to be, that's why his dad was so strong. That's why Mr. Sorry was so strong. He can freaking, that was Pops was so strong. He can hold it so he can move the weight. Think about it. If you cannot hold it, what makes you hold it? All the muscles come from where? Elbow. Now you're letting your elbow suffer for the consequences. Now, this is an advanced form of this. I don't use this unless I have somebody that is semi-strong, can hang in there, because I'm going to involve rotation now. Now I'm going to involve the obliques into it, which is pretty cool because you have somebody with pain on the QL, you have pain, oblique strain, like who's Coach Ivy again? Like Coach Ivy. I have to be aware of that. So this is a form that actually helps people with what kind of pain? Growing pain, right? Because the growing pain involves rotation. If I'm going to be here, I'm going to rotate. What has to hold me steady? My adductors, my hamstrings, everything, so my groin can react. So here I'm going to include groin exercise without loading with weight. It's just resistance. How difficult can I make this, Jen? Jen has a great ass, so I got to show it off.
It's like a big swing.
Go up there.
I take the compliment fully. Listen.
Okay, now, remember, she's strong, so I'm going to prove she's strong. Go ahead. Hand yourself. I want your legs back.
Am I here?
Yeah, and do your leg curl. Okay? Look how Jen is keeping her legs back. Now, I don't like Jen, so Jen has to stay there steady. Steady, 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 Jen. What is that? Don't let me rotate you. Got it?
Yep.
I am involving now what? The obliques. I can be a jerk. I can do this. You see? And she's actually very strong. Now, put your legs back. That is not bad at all. That is actually excellent. Now, I want to add more resistance. She's feeling her hamstrings. I want to add more to that. Now I'm going to, because remember, when you're doing that, your adductors are doing what? Contracting. Now I'm going to really make her contract. Now she's going to feel it. I need the assistance of a good-looking guy right here. Hold on a second. You hold those. Yep. Jen, I'm going to give you this when we're done here.
Okay.
Hold on. Go ahead. Bend your legs. Let me hold it there. No. Hold it. Okay. This is also, she's not moving her hamstring. She shouldn't have any issues. She's just cramping because, it's cramping. Go ahead and wrap her ankles. Wrap her ankle on your waist, on your side there. I'm going to make it a little difficult for Jen because she's strong. I'm going to put that there. Don't, bend those. Thank you. And then you pull. Pull. Come on, pull. There we go. Play with her. Do it. Look, play with her. There we go. Come on. Jen, don't let me move you. Come on. There we go. That's what I want. Now, how hard is that?
Pretty hard.
Thank you. So there was the obliques, the abs, everything else. Doctors, thank you. Okay.
My hamstrings are kind of threatening to cramp. Does that mean my hamstrings are weak or am I?
That is a great question. So Jen's question is, my hamstrings are cramping. They're no used to, number one, I use, were they cramping before I put the weight?
No.
Okay, so no, because she's in good shape. By adding the weight of the thing, they're not strong enough to handle that weight. And the way to protect yourself, it give you cramps, so you let go. Don't. Stick with it. Because eventually, you will break through that cramp, and you won't cramp at all. Okay? Any questions about any of those exercises? I hope that helped you with therapy or whatever you guys are doing. Another person asked me about scar tissue, so this 10 minutes of scar tissue. When we cut a patient, right, we open you up, we save your life and we don't think about it. And then we just stitch you together. The only problem is that when I have a fascia, so I cut you up and I'm going to look at the fascia and I open that fascia up, there's more nerves in the fascia than the spine. Let me repeat what I'm going to say. There's more nerves on your fascia than your spine. So sometimes when you hurt your muscle, you say, my God, my muscle hurt. It's not your muscle, it's the fascia. The problem with the fascia, what's the fascia? The fascia doesn't like to do what? Stretch. It's a tensile force. So now I'm going to cut this right here. I'm going to cut you open. Right? Cut you open. And I stitch you. But I don't put the red light where it was supposed to be. I don't connect the green lights where they're supposed to. So what happens to your scar? It doesn't connect. What happens to your muscle? It doesn't want to work. You start having issues. So, for example, I want to give you samples. If I have a patient I had a patient, she's beautiful from Brazil. Great patient. She had been having pelvic pain for 8 years. Unable to have intercourse, it's just crazy pain. But she had a massive C-section scar, right? Went to all the specialty, back shots, everything. All I did was, you guys familiar with the dolphins? Nobody know what a dolphin? Jen said the dolphin animal. Yes, it sounds like a dolphin, the animal. Dr. Celia, are you here? Where are you? Dr. Celia, can you bring your dolphins for a second? So this is pretty cool because this actually makes your scar get smaller, but also fixes the conduction. Coach Tom here from Florida. Tom, where are you? Tom, what happened to you 3 years ago when you were here with me? Yes. Did I know your story? Do I know anything about you only when we talk? I just wait. Brian brought him to me. I said, let's fix this. Which actually Tom and I, after that, we became friends, of course, right? And Tom went ahead and bought the Dolphins. They work amazing. If you have any conduction, if you got migraine headaches, if you got TMJs, if you got TBIs, they are amazing, amazing, and easy to learn to use them. If you're a therapist and you don't have Dolphins, I think it's off. You should not do it. Now, I also see a lot of people with phantom pain. Bring it back, bring it back. This is Dr. Seeley, by the way. Dr. Seeley is a weird guy. He's actually also my son-in-law, so that's why I like him so. But when it comes to TBI, like brain things, eyes, I have seen him do magic. People that walk normal, they think they walk normal. He treats their eyes, they do walk normal. People that trip with their running, and this is, I'm not making this up, he trains their eyes and they're normal, which is crazy. That's what he specializes on. So if you have a question about the brain, go freaking abuse him today because I want him abused, right? Be aware that the Dolphins are, and let me show you what it is. All this is this. Tom, come to the front for a second, Tom. Come here. All is this. I didn't invent that. I don't sell it. I'm not making any money to you guys. I just want to teach things that you can take back so you can use it. If you have a person that is injured, has any type of nervous, if they cut the leg, if they did something to that person, this does magic. Tom, show how you use this so they know.
Give them the full
Yeah.
rundown.
Yes.
All right, so there's a couple settings, negative, positive, plus, minus, polar settings. All you're going to do is you're going to find acupuncture points on the body. Right now it's on the negative setting. So I'm going to find a spot. When that light goes off, I'm on a spot, my body's going to receive that energy better, and it's going to help heal better. And then when you turn it on, it's just going to start chirping and beeping and blinking and making, that's why it's called the dolphin, because it chirps kind of like a dolphin.
It doesn't hurt. Well, it doesn't. Wait. I'm lying. I heard you. Tom, he's bigger than I got to be careful. I did hear him.
I've found with some guys, if you really have an issue going on with scar tissue or your nerves are really not functioning properly in that area, it can hurt really, really bad. If it does hurt really bad, you just turn it down to what they can handle, and more often than not, as soon as you're done with that treatment, you get instant relief. Every person I've ever put it on our team that's been like, oh shit, this hurts, and I have to turn it down on, they have come back within 2 days because they feel so much better immediately when the session's done.
My son cried like a girl, which pisses me off, military guy. By the way, to all those guys here, thank you for your services, including the fire department. You can go. Yes, what's the question?
Is that site-specific then?
It's a site-specific, meaning like only one area? No. Actually works actually, anybody with a hamstring issue here. Let me use Gunner, and then Tom, I use you. Get up here, little Gunner. Come here. Okay, this is interesting. Jump over here. Jump? Sit over there. Yeah. Okay, be aware what is, can I borrow your beautiful, sexy, this? I really hate this. I hate these shoes. Why? I used to get my ass beaten with shit, but not with this. Rubbermaid. The grades were good because my mom beat the shit out of me, by the way. No, the reason for this is when you do flip-flops, how can they don't fly away when you're walking, when you're swinging? What are you doing with your toes? Curling. Okay? So you are actually making your hamstrings do what? I'm going to show you what hamstrings do when you don't use your toe. Actually, I'm going to also treat her so she can see what happens when you use these suckers. Now, when you start using this, by the way, you eventually will develop low back pain. Okay? So she doesn't have any, right? You don't have any? Oh, she does. Okay, she doesn't want to admit it, but she does, right? The reason for this is I grab it because I'm going to take a walk, and by me bending your toe, your big toe, completely does what to your hamstring? Right now, everybody sitting down, put your feet flat on your floor, please. Contract your toe like you want to grab something. Tell me what happens with that. You guys feel the sensation all the way up. That's because your freaking toe activates your damn hamstrings. Your toe activates, and that's what's going to make Gunnar suffer. Now, which leg is the one that bothers you? Okay. A good doctor, okay, this is awesome. This is technical. This is Dr. Gappin here. Why did God give you 2 of everything but 1 tongue, 1 asshole, and 1 wiener? That is a scientific, oh man, you guys are laughing at me. Who has 2 tongues here? Nobody, right? He gave you 2 balls, but that's another question there. But, okay, the reason for that is the most body part that can get you in trouble. Think about it. If you think of any time you ever had a trouble, what was it? Right? So God only gave you 1, so you don't overuse it, right? But everything else, he gave you 2. And the reason he gave you 2 is so doctors can compare the flat tire with a good tire, because we're dumb. As soon as you go to the doctor and you have elbow pain, what do? They check the elbow. What happened to this elbow? How do you know that this elbow is wrong? I got pain there. But if you look at the structure of the other elbow, you move it, the pain will tell you, or that movement of the other joint will tell you a lot about that joint. I never examine the joint that has pain. I always go to the opposite joint. Once I know what I can do, then I go to that joint. I never examine. Now, on your tongue, then you have issues, right? So he said, Gunnar has pain. Where's your pain? Center of the hamstring. So, okay. So pull me back. How much pain? Weak. Okay, watch what I'm going to do. I'm not going to touch his hamstring, right? Man, I know what kind of people you are. So now, I'm going to use this.
Just on the hamstring, right?
I'm not going to. Okay, look how the girl is. Just the hamstring. Watch me. I'm not going to even touch his hamstring. Watch what I'm going to do. Can I have your leg for a second, sir? Just a little toe.
Ow!
You know what? It's going to hurt. It's going to hurt. And it's going to get her worse. I'm going to enjoy this for making fun of me. Never do. How bad is it hurting, Gunnar?
Bad.
It's bad. You hear that?
Yeah.
Tell me. Oh, it's burning. It's burning. Okay. How bad is it hurting?
Bad.
Can anybody? He's hurting really bad. Okay. I'm going to stop. I'm going to do this one right here.
God damn, man.
What, you told me. What did he say? Do not touch what? I'm not even touching the hamstring. I'm just touching his toe. Can I touch your toe, please, sir? Thank you. I knew it was going to hurt bad, but, just for the hell out of it. Can anybody count to 20 because he can't handle it? Look at him shaking. 20. I just want 20. Tell me when 20 goes by. 1, 2, 3, 4, 5, 6. He's stopping now. 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 18, 19, 20. Okay, thank you. Now, I'm going to test your hamstring again. I did not touch his hamstring, but I want to see what happens. Push down again. What happened? He feels now he cheated. Okay, now he wants me to look back. Go ahead, do it any way you want to. Anyway, what happened to the hamstring? Go. Okay, now, this is interesting. The reason he said my calf is helping me is because actually the calf is helping. What did I say that activates your hamstring? Toe. Put down your toe. Now bend. What's happening now? Keep that toe down. Keeps the soleus. Okay. He's confusing the hamstring with the soleus. So this is a person, I'm going to show you one more exercise for hamstring. Sorry. because I want to kick his ass, right? The reason I want to kick his ass is because I want to show him that there are ways to actually activate this sitting right there. Now, this is actually extremely hard to do, but I want to work this. I want to work it without movement. I want to do actually an isometric hold. The reason I want to do isometric hold, I haven't examined him, so I don't want him cause movement. I just want to hold it there. So I'm going to do something real quick. I'll be back. Can I have my bands back, please? Thank you, thank you, thank you. Can I have my medicine ball back, please, too? Can I have that ball there? I'm going to enjoy this one. Oops, my child. Thank you. Okay. Give you. Okay, I don't want movement. I'm making this really easy for him because, hell no, I don't want that. I'm going to use this little shoe of his. Okay, first of all, uses this. Okay? What does this do? What does this do? Arch support. Say it. Say it. You're correct. Say it. It changes the mechanics of how we move. This is a partial cure for symptoms, not to fix the reason. I used to do this. I stopped because I wasn't fixing nothing. What do I do? I made the patient think that it's better because now I'm supporting the tissue that doesn't need to support. It needs to get stronger. Got it? So Dylan is the expert on this. Dylan, where are you? Dylan, how often you use this? Never. I would never use this, but that's okay. Now, sir, I want you to hold your shoe right there. Okay? And at the same time, I want you to lift your leg up, make it straight like you mean it. I want full contraction. You're going to push with one finger down. Okay? One finger. Hold on. Are you ready, sir? Hold on. Let me do this here. Let me pinch. One second. Pinch that shoe. Okay. This is an easy exercise. I will hand a weight from that leg on a bench. Push, push, push. Push a little harder there. Thank you. He needs to lift that. There we go. Now, what I'm forcing him to do? Contracting his hamstring really hard, but what is the pelvis doing now? I got to extend my leg, right? But I'm freaking working now. Where do you feel this, Gunnar? Ooh, left hamstring. Ooh, left calf. Now, watch what I'm going to do to his calf. Can you pull your toes down all the way? Thank you very much. Now, that really activated the hamstring. There he's going. Do you feel it more, yes or no? Thank you. You see? Now, on him, I will absolutely do that first with him because he's actually weaker there. But the problem is I will have to fix his feet first because the feet are shutting down his hamstrings. So this is not an easy fix. This is not his hamstring actually, it's actually his feet, which I'll let Dylan, if he wants to go with him going later, this can be fixed. You don't want that. Move your hamstring and see how it feels now. How's it feel? That's right. He's on a cramp, but he's only moving it. Stand up and walk a little bit, see how it feels. How's it feel? Crampy. He's only walking, you see? So if we don't fix that, he's going to have issues. Actually, he probably tear it. But we need to fix the feet first. So I have to work with him a little later. Okay, any questions about that exercise? Any question about the scars and dolphins? Okay, yes. Tom, wait a second. I do need you up here, though, because you asked me to treat you, correct?
What I asked, do you put it right on the point of the spot?
No, you don't have to put it on the spot. It depends. You can put it. So the question is, if I have a tear on my hamstring, do I have to put it there? It helps if you put it there. It doesn't have to be placed there. It can be in your SI joint. It can be below and above the joint. Yes?
You were on a podcast with Coach Ivy, I think, research roundtable, whatever, talking about massaging scar tissue.
Okay. So, Yes. So the question is, I did a podcast with Coach Ivy. That was a long time ago, and we discussed scar tissue. And what happened to me was God is awesome. I had a patient of mine that he was a very famous therapist. He's from Italy, and he flew in to be my patient. He had heart issues, and we became very good friends. So I flew to Ireland to give a conference, and in that day, they brought a guy that was supposed, I'm not making this up, supposed to have hip surgery the next day. And he was the cousin of the guy that was doing the presentation, and they wanted me to examine. I examined this guy, right? He had a lot of pain moving it, barely walked. He was using the double walker. My friend said, I need to be with him in the room by himself. I was like, what are you doing there? So I got to be by myself, Serrano. I'm not making this up. I learned so much that only in 2 minutes. He was there for 6 minutes, and I'm going to answer that question. For 6 minutes. Not that this guy came walking like this, watch. He could not move. I couldn't move his hip to examine him. I said, I can't do anything because I don't have the x-rays. I'm not making this up. 6 minutes, it took 6 minutes. He comes out like this, crying, like walking, doing this. I said, there's no way. Show me. Step-ups. No pain. Guess what caused the pain on the hip? And that's going to answer your question. I didn't go through a history because I have a lot of people waiting, but my friend took the patient into the room, and he had shoulder surgery 3 years later, or 3 years before the hip pain, right here, or the opposite. It was the opposite of the hip. And he said, how long have you had this pain? He had been going on for 3 years. He's getting worse and worse and worse. My friend said, Eric, I never told you this technique. All he did was take the scar, milk it, but it had to be 6 minutes. That's why they spent 6 minutes. He has the research. He showed it to me. You got to take the scar and milk it. And when you milk it, so this is the scar right here. I'm going to take it. I'm just going to squeeze it. I'm going to knead it like kneading it, up and down. But it had to be for 6 minutes. Count it. You can do it for, because I'm an asshole and I doubt everything like St. Thomas, I went home at 3 minutes, 2 minutes. It took always 6 minutes. So you have to do it for 6 minutes, back and forth. It doesn't matter how long that scar is. You have to do the scar up and down, 6 minutes. And it will actually, that patient never had surgery. He's still a patient. Actually, he calls me for everything. Zero, nothing. He had no hip surgery. That's like Tom that was going to have shoulder surgery. He didn't have to. So you have a scar right now. Anybody here, and you start playing with it, but need it. And you have to time it. Has to be 6 minutes. He told me that. It has to be 6 minutes. Any questions?
What's the requirements to use dolphin?
Dolphins can be used in anybody. I had not found one single patient. Oh, I had a case of a baby in my office that had, the rectum wasn't well formed. Anybody can use it. PT, massage therapy, anybody. Once you have massage therapy, physical therapy, anybody can use them. Certain coaches can use it. Tom, do you use it with your athletes? And you're not going to hurt the patient. This doesn't hurt. The only way this is going to hurt you, my wife can't hurt me with this. I'm sure she will stab me, but, that's the only way. It doesn't. Does that hurt? Does that hurt? It doesn't hurt. It doesn't do anything. If you have nothing, if I put this here and I treat it, I'm not going to feel anything. I have nothing wrong. But if I put it where it hurts, shit, you're in pain. Gunner here trying to make me look bad. Did I touch his hamstring? No, I touched your little toe. Oh, it hurt. But if we wanted to fix it, I thought we need to fix the whole. I have to treat the plantar area, but if Dylan wants to, he can fix it. But without touching the hamstring, by the way. It's not the hamstring. The body tends to keep everything away from the center. The spine is the most, for men, you know what it is, but for people, the spine is one important organ and doesn't want to get hurt. So everything is trying to be kept away from the center. So it will give you elbow pain. So anybody with elbow pain here? Okay, come here. Who has elbow pain? Come here. Where's your elbow pain? Okay. He has elbow pain. What does the doctor do? Watch. I'm the doctor now, right? Oh, you have pain there. How bad is it?
Pretty bad.
No, I want a number, 1 to 10.
7.
7. Okay, it's because he had too many damn tattoos. That's my 9. Okay, it's not that, but I'm just giving you shit right now. Now, I want you to push where it hurts yourself. Tell me when you get to 7. Right there. I'm not going to touch that. I'm going to show you something. Now, the reason for this is I want you guys to understand the body. It's very hard how the body works. God is perfect. We do not know shit. The doctor doesn't know anything. I don't care who the doctor, even me. I got to see 100 to see what's abnormal, right? So go ahead, touch your elbow. Before I do this, what makes you have pain? Like a curl? What do you make you have?
Almost anything. But yeah.
So almost anything.
Pulling especially.
So pulling. So let's see. That's too heavy. 15 pounds? 25? 25, okay. Ooh, I can't lift this. Do you guys see that? Okay, go ahead. How much pain? So 2 or 3, stay right there. Now, I'm not going to touch his elbow, but I want to show you guys how the body works. This is pretty impressive. I can fix it, Dylan can. I'm just the asshole that give you the diagnosis and I tell you where to go. So, I'm not going to do anything. Ooh, okay, go ahead, do it. How much pain? 1. What did he say? I didn't hear you.
Yeah, like a 1, yeah, it's less.
Now, I'm going to take the whole pain away. You ready for me? Yep. This don't feel good, but the pain will go away. I just want to teach you, and then Dylan, sorry. Go.
Yeah, it's fine. The back feels bad, but everything else.
What happened to your pain?
Yeah, it actually spiked a little bit. Yeah, it felt good.
It felt good, and I didn't touch him. Now, drop that for a second. When he examined himself, he said he has pain 7. Touch it now again.
No, it's like a 3, 2 or 3. Yeah.
Now, I'm going to make it go to 0. I can actually fix this guy today. I'm sure you've seen the doctor for this. I can fix this guy. It takes me 5 minutes to fix him if I want to. I'm not going to, because he doubted me. But I can completely take the pain away. So if you examine him on the fascia of his lower lat, it has a little more involvement than this that I'm going to do now. He's going to feel fine, but he needs to do exercise. The fascia connects from the spine, fascia from the lat, all the way to your elbow, all the way to your little finger. Your pec touches all the way to your thumb. If you go like this with your partner next to you, I want you guys to stand up and make the partner push you back with your thumb up. You won't be able to stop him. As soon as you close that thumb, absolutely you can stop them. That's because activates your pec. You can do it yourself. So I'm going to stop the pain, but this is not going to feel good. Now with the dolphins, I can do this, but it might take a little longer. I'm going to do something here. I have a scar tissue on the back, okay? Yeah. Okay. Okay, rotate for me a little bit and bend down this way. I'm not having sex with him or anything like that, but. Okay, now touch your elbow. I didn't hear you.
That's gone.
So, but wait a second, come out. I need to show him, he needs to do 2 exercises for me to fix it. And I can show you.
Oh, yeah.
You want me to show you guys or? Okay, so, oh shit, hold on. Let's go back there. Damn it. Man, I'm sweating, I'm jogging here. I don't jog. I walk to the bathroom and to eat. Okay, go ahead and wrap that shit over there again.
Wrap it up.
Yeah, wrap it up. Okay, this has to be a strong band. This cannot be a weak band. I just want to show you guys so you guys are aware of how you do it. It's easy trick. Again, all I did to his back, by the way, what's your name?
John.
John, very nice to meet you. All I did to his back was take the scar tissue and grab it. There's a point, actually, he has a hip issue too. I didn't tell him, but There's a hip issue. He's going to have hip issues if he doesn't fix this stuff. He has an area in there that's very scarred. Right out of the bone, it has a very long nut. All I did was grab the nut, I broke it because it broke. That's why the pain is gone. But it's going to come back if he doesn't do this. So I want to prevent that from coming back. So sit down. No, sit down. So most people do pull downs, right? You all do pull down. When you do a pull down, where do they stop? Right here, because everybody does that. I don't like that, but to activate my lower lat, I got to do this. I put the elbow in, because I want to always measure. I don't want to grab it here today, tomorrow lower, right? Because you don't know if you got better. You got to put the band on your elbow. Once you have your hand on your elbow, then what you're going to do, straight, you start, hold on a second. Right there. You're going to start right there, and you're going to calm down, calm down, calm down, calm down, calm down. Chest way out, and I want your armpit down to your hip. More than that. Armpit down to your hip. Come on, rotate a little bit. Right there. Stay right there. You count to 8, right? Now, if you're strong, I cannot move that elbow. I'm a fat ass. I haven't been doing too much, but I know if I sit there and Jen tries to touch me, I might go away. But if you're holding me, you cannot move me from that area. Don't make me move you. Got it?
Try my best.
Go. I can break it. I know. Come on, hold it as far as you can. There we go. Don't let me break you. Come on, hold it. Hold it. There we go. Chest out, chest out. There we go. Okay, stop. Let's check your elbow again this time, yourself. Go ahead. It should feel a lot better, actually.
Yeah, it feels a lot better.
No pain. Now, he has to do that every day for 3 days and then once a week. Got it?
Got it. Thank you.
Yeah. Okay, wait a second. What's wrong with your elbow?
From cleaning, power cleaning,
Okay.
and straps, I think it's just overuse on the inside here from
Where does it hurt? Okay, so this is actually different. So, both elbows?
Yeah.
Okay, this is harder for me because now I don't have. It's something easy to check. He has elbows on both sides. I'm not being fair to you guys. I already know what's wrong. But not big. Damn it, stand sideways. Okay, this is actually, is not his elbow. It's coming from the neck. Okay, so this is interesting. My ears have to be in line with my shoulders. If you're not, either you're spending too much time on the computer or doing something, has to be fixed. How much pain? Touch it yourself. How much pain?
pretty low.
Pretty low. One, 2, 3.
3, yeah.
So this is harder to treat because the other guy has 7. So I look good doing down to 0. Here it's harder because the pain is minimal. But I'm not going to touch his shoulder now. I don't want to do that. So touch it again. Okay. Then that way. I'm not going to touch your shoulder. Do it. Hold it. Tell me what it is. No, tell me what it is.
Non-existent
I didn't hear you.
Non-existent?
It went to 0. How did I do that? Because I look at the patient, I observe the patient. When he got up, when he walked here, actually he did something funny. He got up and rotated, which indicates me he has some issue, maybe on his hip or lower back. I don't know where. Okay? So I was paying more attention. Now, when he came with bilateral elbow pain, rarely is one side is coming from the spine or the neck area. Okay? On him, this will go away. On this, do we have a roller? We have just a normal roller? Like a foam roller, please. Let's see if I can take it totally away. Okay. I should be able to. Thank you, Mr. Soren. You're so sexy. Thank you. Okay. I want you guys to see it. You have to. Let's suppose that this was the floor right here. Okay. Oh, okay, perfect. I didn't know that. Okay, perfect. So he has elbow 3. I can actually fix it, not right here, but he's going to get a lot better. Lay down on back on your flat, back on your back. I want you to put this between right there, and you're going to freaking squeeze it. Your life depends on it, because I'm going to do something. I'm going to hit you in the balls, but your life is going to depend on it. Hold on, I need where's my bands, damn it. Where's my other band? Damn it. Can I have my bands? Shit. Sorry, keeps you working. Thank you. Thank you for my assistant, Dana White right there. Okay, so this is a woozy exercise, but it will make a difference with the elbows. Let's see. I'm not guaranteeing, but I think I can take it all away. Put that down to your shoulders on your armpits on one side, all the way down. Put that one too, because I want to try to fix both of them. I didn't test both of them. I want that a little higher, up higher on your spine. No, move right there. I want you to squeeze it as hard as you can. No, I want your elbows to your, there we go. Don't let me freaking move your shoulders, damn it. You need to hold, and you can imagine that you have a coin there. Your neck, damn it, has to go a little bit posteriorly, right there. That's the key here. Don't, get over him here, hold on. Don't let me move that shoulder. Keep it there. Don't let me. There we go. Steady, pinch that coin behind you. Pinch that coin behind you. Pinch that coin behind you. Okay, relax, stand up. Okay, note that he's playing with 3, so it's going to be very hard. Go ahead and touch your elbows.
That's wild.
I didn't hear you again.
That's wild. I don't know what you're doing.
What? He said, I don't know what I'm doing, but he had no pain.
Yeah.
What do you think of that? I know what I'm doing. Okay.
Thank you. Appreciate it.
No problem. So, by looking at the body, you guys can make a big difference. You just have to find out where the weaknesses are. I'm freaking old, way older than most people here, so it took me a long time to be able to get to there. I was a typical doctor. ICU for 6 years, I was the boss. ER 2 years, I did OB for 9 years, so I wanted to know a little about everything. I used to give vaccines too. I was a vaccinator, like I look like a cowboy. Now, you have to kill me before I give you a vaccine. And this is from years ago, but I mean, any questions about anything right now? Yes, sir. Okay, great question. So the question is, on the lat exercise, you have to start this way. You cannot start this way, you gotta start this way. The reason is, if you guys grab your arm up, put it up. And you're gonna, with your fist closed, by the way, and you're gonna rotate. Tell me what's happening, what happens when you rotate? Like intentionally, what happened to your lat? You activate it. Now, when you come down, my chest out, my armpit has to come and touch. I want you guys to touch. You can't do it, but you feel like you're gonna touch it, and you're gonna cramp. Chest out. Chest has to be out. Lower. Oh, she's cramping. Are you cramping already? Yes. That is bad. That means that the lat is not stable enough. You have to hold it for 8 seconds. So 3 reps of 8 seconds. You have to hold it there. You cannot let it go. You have to do both sides, because if one side is messed up, the other one is messed up. I have tons of exercises that are really weird, and Dylan helps me develop some of them, but I have other exercises to fix other things. The reason I fixed this guy here in a few seconds is just because actually his neck was the problem. Elbow. Now, I didn't give him an exercise to be able to get stronger. He said, when I clean, and I do this, when you are cleaning, what kind of loading are the triceps getting? What kind of loading? Say it loud. Eccentric. Because I'm slowing down my movement back, right? So what do I have to do to train my triceps? Give me a cool exercise for triceps here. Tricep extensions. Okay, you're the hottest thing here. Go and stand up here, Jen. Okay. No. I will do this in a bench. The reason I want to do this, most people train one head of the triceps. Which one? Triceps. Triceps. 3, 3, 1, 2, 3. Okay, which head? Okay, the long head, wait a second, the long head goes from the elbow where down? All the way to where? To the top of the shoulder. You guys don't train that. What do most people do? Skull crushes, which Louis was an amazing person to me, my patient, but damn it, I told him, do no, skull crushes are a no-no. Never, you want to never be in that position. Don't do them with a bar, only with dumbbells. I want to put you in a position that your triceps work every single second, no rest. How can I do that? How strong are you, Jen, for your triceps?
I'm not sure at all.
Okay. 5 pounds? Can you handle 5 pounds? Okay. My exercise 5 pounds is brutal. Sorry. Okay, so now I want to load up the long head, short head, and medial head. It will only load if I change my freaking hand. If you do this, okay, I'm only what? Using a neutral grip, right? If I do this, you guys do this right now. Just do this right now for me. Chan, 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 right? Where do you guys feel that? On the middle. Now, rotate. That should feel in the inside. Okay, do you guys feel it on the inside? Yeah. That's why you get elbow pain when you're doing that the wrong way. Okay, now do it the other way. And you're going to feel the outside. Got it? Who trains that way? Nobody. They don't. And this is huge for pitchers. Huge. Why? What I'm doing. And then what? Coming, right? So the Braves paid me a lot of money to fix a guy's elbow that had no elbow problems. It was easy, but it was good because it was 5 minutes and I made my money, right? So if I'm going to throw even a football, I have to come and I have to rotate it. So Jen, I want you, because I want the people to, no, stand, knees bend like this. I want this on an incline bench. I don't want it standing, but for Jen's reason, I'm going to keep it there. Okay. Here, she's going to use the long head because now she has to force to use the rhomboids like you're supposed to, and the long head of the tricep is being used. I invented a system called the ischemic system in which I made you contract the muscle. I have all the exercise and the other movement of the other arm, leg, whatever. So you're going to hold this up here. Hold it right there. Hold it right there. Thank you. Now, keep that elbow up. Do 3 rests with this arm. 1, keep that elbow up. 2, 3, switch grips. Wait a second, stay there. This grip switches. Where do you feel that? Yes, it kills. It kills.
Way inside.
Way inside. All I did was, now, go ahead, up again. She took a break there, that was bullshit, but that's okay. Okay, do 3 reps that way. Hold this one up, elbow up. I won't use it in the long head, there we go. The reason you're doing a bench is because it forces it. One more. Okay, now, which grip is left? This one. Yeah, go. That's, there. Oh yeah, you hold it. 1, 2, 3. Now you hold that. Now you're going to do this one. You guys got it? Okay, that's good. You guys get it? I'm concentrating ischemic changes on 1. Hey, come on. Thank you. I like that. I like that. But that will help you when you do the cleans. It actually will help you low. It will allow you to slow down the bar better. Okay? It has to be done in a bench, though. That way you stop the movement. I will actually put a broomstick so you don't touch it on your back. So it forces you to keep that above your back. Any questions about that? Any questions about anything else? Oh, shit. Okay, go. Low back.
Yeah. So usually, obviously, you have
Okay. Okay. So the question is low back. How do I check the patient? Dylan is better than I am about this. But if you don't have, okay, I'm going to say you don't have a disc herniation or a tear. Okay, I'm going to separate that because that will have to be fixed first. Then I assess your hamstrings and feet first. Okay, always low back pain. Access the hamstrings and the feet first. Then what's the next one you need to access? Not the lats. What's the next one? Abs. Abs surround your spine. You have low back pain, I take it? Come over here. And I know I have 3 more back there. I go fast. Oh, shit, I got 2 minutes. Damn it. Sorry, guys. Hey, wait a second. Any question that require words? No me touching anybody. Go ahead. What's the question? Go. Yes. I don't know if I call it slack because I had never done a biopsy. I think it's more of a neuromuscular system together. This is a great question. Say it loud because I want them to hear. Stand up and say it. That's an amazing question. But give the sample. Yes, I am. You're correct. I'm retightening, but I'm also teaching it to loose also when it requires. Leslie Soren, what's your question? So the question is, when did I change my vaccine opinion? What made me? In 2004, I was doing OB, and I just delivered a baby. And I went to talk to the lady I delivered, and she goes, hey, Serrano, what are the ingredients on the vaccine? And I stood there like a deer, just, what? And I'm thinking, who gives a shit? So I said, you know what? And Lori, I'm going to come back, and I'll tell you what the ingredients are. I went into my fridge, I opened that piece of paper, and I never looked back. I said, I would never give this to a freaking chicken. You guys know what the ingredients are on a vaccine? There's average 11 ingredients. That's the minimum. I never counted less than 11, by the way. Go ahead. If they remove those ingredients, would I give the vaccine? No, with what I know now. No, I wouldn't. And let me. Yes, because they said, I read the ingredients now, right? And I went back into that room and I said, oh my Lord, I would never give this to a dog, right? So then I went, I'm a nerd. You can ask Tom, you can ask Brian, anybody here that knows me. If you ask me a question, how many papers do I send you? Lots, because I want to read. So no, the answer is no. I went farther from there and investigated and I did research. There's a book called Child Vaccination, Truth or False, right? Fauci, I read all those books. When I started looking into it, I have 5 kids, by the way. My oldest is a nurse practitioner. My second daughter was the head of genetics at Pfizer for the vaccine, by the way. He helped develop one of the lipoparticles. So I knew a lot about that vaccine. My third one is a vet. My fourth one is a nurse. And my son is going to pilot school, right? So I asked my daughter if I get the rabies vaccine, right? You guys know what the rabies vaccine is. And a rabies dog bites me, do I still need immunoglobulins? And what was the answer? Yes. So what the hell? What do I want that shit for? No, you don't want it. I will not get a vaccine even if they eliminate the ingredients. Okay. Now, the reason I don't like vaccines is how it's also introduced to your body. There's an injection, which is not a natural way to introduce diseases, by the way. They only go through where? Remember that, what I say? The holes, right? The only one you have one. Remember that. That is a natural way to introduce a disease to you, blood transfusion or drugs, but you're creating a hole in that barrier. That's totally different how we give vaccine. For example, polio, that they say that they eliminated. You go now to the doctor, you have a kid, they give you a shot, polio shot, right? Why do they do that? It doesn't do anything. Zero, because polio, you get it through the mouth. It's oral. You require something called IgA. If you don't take it orally, you do not get protected against polio. The reason they stopped it was because the people getting the oral polio were getting what? Polio. One batch? Okay. Okay, that's okay. Okay, let me see. Okay, where's your low back? Okay, what makes it worse or better? Okay, you don't have spondylolisthesis or nothing like that on the x-ray. Okay, so he has pain when he goes back, right? Lay down on your back. Oh, what's the pain? 1 to 5. 10, 1 to 10.
6, 7.
Okay, grab that little black ball right there. You're going to squeeze it between your legs as hard as you can. I want you, this is really hugely important. I'm going to put this on the, after you take your shoes off. Whatever you do, your feet cannot get off the floor, okay? It shouldn't hurt at all, nothing. Put this on your feet. So, hold on a second. Step on them, step on them.
Are you putting it in the arches?
I'm putting the band on the arches, yes. One second. Go ahead. Put on the arch. Okay. Whatever you do, do not lift it up. You're going to squeeze as hard as you want that ball. Has to be, your life depends on it. And your toes cannot, you got to squeeze your toe. Right? I'm not going to touch his back. Go. So let me lift you up. Now lift your butt up from the table. From the floor. Come on, higher. Lift up, lift up. You're cheating with your damn elbows. Do not cheat with your elbows. Come on, don't let me lift it up. Squeeze as hard. Don't let that ball go. Come on. Come on. Hold it. Bring your legs, arms that way. Come on. Come on. Don't let me lift it up. Come on. Now to the other side. To the other side. Come on. Hold it. Hold it really hard. Hold it. Down. Up again. Go. Hold it. Up. 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 Thank you. Go to your left. Come on. Hold it. Hold it. Rotate. Rotate, rotate. Okay, relax. Come stand up. I only did it twice. Let's see what happened. Okay. How much pain now? How much pain?
0.
So, wait a second. To fix this, I'm done. Thank you, boy.
You're a stud.